liver. So in other videos I will tell you about the morphology, the gross anatomy of liver. That will be in the other video. So today only we will focus on the histology of liver. So liver, it is the largest organ of the body with weight of 1.2 to 1.5 kg, and we all know that it is the largest gland. So every gland, it has mainly three structures, three components, that is the stroma, the parenchyma, and the ductus. So here the liver, it is covered, the stromal part of the liver, it is covered by a Gleason's capsule, which is also with the connective tissue septa, which sends many connective tissue septa to the to divide the liver into lobes and lobules. And the parenchyma of the liver is made up of hepatic lobules, and this hepatic lobules, you see, for the sake of simplicity, we have divided the hepatic lobules into the classical hepatic lobule. For sake of this classical hepatic lobule, it forms the structural and functional unit of liver. So with the central vein in the center and portal tracts on the sixth side, having this, what are the constituents of portal tract? One is the portal veneum, the bile ductule, and the hepatic arteriole. So these three structures, they are found in the portal tract. You know that the liver, it has dual blood supply, that is 30-70. The dual blood supply comes from 30% from the hepatic artery, 30%, 25 to 30% from hepatic artery, and 70 to 75% from the portal vein. The blood which comes through the portal vein, it is rich in nutrients, and the blood which comes through the hepatic artery, that is rich in oxygen. So the liver has dual blood supply. And here what happens is, I draw the sinusoids. Here, this pink color, these are the sinusoids. And within the hepatic lobule, we find these sinusoids, and these, the blood from the hepatic artery and portal vein, they will be pouring the blood into the sinusoid, and the blood will enter finally into the central vein. Then from the central vein, it will, from different lobules, it will form sublobular veins. Then it will form, collect to form the intralobular veins, then interlobular veins, intralobar veins, then interlobar veins. Then finally, it will drain into many hepatic veins will be formed. That is, it will form the right hepatic vein, left hepatic vein, and all many hepatic veins, they will be finally draining into the inferior vena cava. So the blood from the portal vein, portal venular, and bile ductule will come. The direction of blood flow will be towards the central vein. So it is centripetal towards the central vein. And finally, from all the lobules, the central vein will merge and they will form the hepatic veins. These hepatic veins will ultimately drain into the inferior vena cava, which we find in the we will find in the liver. So when on the posterior surface of the liver, we find the inferior vena, groove for inferior vena cava, and this, the hepatic veins draining into the inferior vena cava, it forms the main support of liver. Then we will talk about the hepatic legs. this is the hepatocytes. These are arranged, they will radiate from the central vein. They look like radiating from the central vein. And in human beings, we find that due to scanty connective tissue, this regular arrangement which we often found in the books, it is not present. Due to which sometimes we find a central vein and 2 to 3 portal tracts. There is not a regular arrangement that which we find in the books, that is not found in the reality. We can see the central vein. So when we see a slide under the microscope, so in light microscope, when you see, we look for the central vein, then we look for the portal tracts. But this arrangement, regular arrangement, is not there every day. Then what do we see here? These hepatocytes, they are found to be radiating from the central vein, and these hepatocytes have 3 surfaces. One surface is facing to the sinusoids, hepatic sinusoids. The other surface is facing to the biliary surface. Another is a biliary surface. So we see there are 3 surfaces and intercellular surface. So first, so the sinusoids, hepatic sinusoid, these are lined by 2 types of cells. These are fenestrated and they are lined by 2 types of cells, the endothelial cells and Kupffer cells. At places we find Kupffer cells. So this is the sinusoidal, this is sinusoids. And the hepatocyte which is facing the sinusoids, they have microvilli. The sinusoidal surface of the hepatocyte, they have microvilli. And in between the sinusoids and the hepatocyte, plates of hepatocyte, we find another space, that is called space of Distel. Space of Distel, which is between the sinusoids and the hepatic plates. And here, between the 2 adjacent hepatocytes, these are the microvilli facing the sinusoidal surface. And the hepatocytes which are facing the adjacent hepatocytes, they have a biliary canalicular surface. That is, the liver is an exocrine as well as an endocrine organ. So the exocrine component, the exocrine function of the liver is to secrete bile. So these bile which are formed within the hepatocytes, they are collected within the biliary canaliculi, which is nothing but they are only the plasma membrane. They are formed by the plasma membrane of adjacent hepatocytes. This is one hepatocyte, this is another hepatocyte, and this is another hepatocyte. So you see so these biliary canaliculi, how are they formed? They are formed by the plasma membranes of adjacent hepatocytes. Okay, so each hepatocyte, it has 3 surfaces. This is the sinusoidal surface which is facing the sinusoid and it has microvilli. This is the biliary surface, canalicular surface, which is forming the biliary canaliculi, and these are the intercellular surface. Above and below the biliary canaliculi, these areas are intercellular surface which have occluding junction or it may have gap junctions. Okay. So these biliary canaliculi, they will take up the bile. And from here what happens? In the intermediate region, these bile will be draining towards the portal tract where you have bile ducting. So the flow of bile is just opposite to the of the blood flow. The blood was flowing from the hepatic arteriole portal venule towards the central vein. It was centripetal. But the biliary flow, the bile which is formed in the intercellular biliary canaliculus, that is carried out to the bile duct tube, and the flow is centrifugal. It is from center to outside. And what happens here? The bile duct tubes, these are they will collect together, they will form canal of Herring. The bile duct tubes, these bile duct tubes will merge together to form canal of Herring, Herring, canal of Herring. Then this leads to intralobular biliary system, then interlobular biliary system, then interlobar, like this it goes on, and finally it forms the right and left hepatic ducts. These hepatic ducts, after they get a branch, they have a drainage from the cystic duct, they will form common bile duct. And ultimately, in these common bile duct, along with that of the pancreatic duct, it gets the secretion from the pancreas to the pancreatic duct. The common bile duct and pancreatic duct will finally open into the second part of the duodenum. This will open into the second part of the duodenum. The common bile duct, it is surrounded by the sphincter choledochus, and the pancreatic duct is surrounded by sphincter pancreaticus. And this, there is an ampulla of Becker, and this is these three components, they will form sphincter pancreaticus, sphincter choledochus, they will form sphincter of Bode, which will open into the second part of the duodenum, above which is the foregut and below it is the midgut. So the direction of the bile and blood is opposite to each other. The direction of blood is centripetal, but the direction of bile is centrifugal. And we know that liver has a regeneration capacity. So if 1/3 of the liver is also left, then 2/3 of the liver can regenerate. So from where does it regenerate? Where do the stem cells for this regeneration they lie? They lie within the bile duct tubes. There are certain cholangiocytes which line the bile duct tubes, and certain modified hepatocytes, they also line the bile duct tubes or canal of Herring. So from these cells, the whole of the liver regenerates. So we all know that hepatocytes, the liver has many functions. It is both exocrine and endocrine. So exocrine function is formation of the bile, and this is how the bile is carried. And the lifespan of each hepatocyte is 5 months, and the size of each hepatocyte is 30 to 50 micrometer, and it has 3 surfaces. We have already completed. Then what you see in histology, the various portal lobule, for the sake of simplicity and to some researchers have given a concept of portal lobule. So what is portal lobule? We know that this is the classical lobule, and there is another concept of portal lobule and portal acinus. What is portal lobule and what is portal acinus? So, if we join the central vein of 3 adjacent lobules, hepatic lobules, if we join the central vein of 3 adjacent hepatic lobules, and in the center what we find? We find the portal tribe in the center. So 3 adjacent hepatic lobules, if we join the 3 central veins, It forms a triangle with portal triad in the center. This we call it as portal lobule. Portal lobule. So this is a biliary concept because here, from here what do we see? The bile will be draining like this. So this is one concept, that is the portal lobule. And what is portal acin? What is portal acinus? So here in portal acinus what happens? Here is one portal triad and here is one portal triad, and the central veins are here. So we try to join. This is the long axis. The central veins, the two central veins, they are the long axis, and if we join the portal vein, they will form the short axis. And here we divide the liver into three zones, that is zone 1, zone 2 and zone 3. So these are the three zones. So accordingly we can see that in zone 1 is exposed to rich blood supply. So if a patient who takes any organophosphorus poisoning or anything, that directly comes to affects zone 1. And this zone 3, it is exposed to less oxygen. So if there is any hypoxic injury, this zone 3 is more prone to be affected. So this is the concept of liver acidus. So this is all about the histology of liver. So we know that it has both exocrine and endocrine function. The exocrine function is to form the bile. So what are the components of bile? There are, for easy remembering, just make a start. What are the components? Bile salts, bile pigments, then IgA, cholesterol, lecithin and phospholipid. So this is how the bile is formed, and it is taken by the bile canaliculi. Then in the liver acidus, these are, so this much we